Hello there, this is Dr. Brown Hilda Santo. Today we'll talk about another very important topic, syncope, where some people they call and say fainting. What it be syncope? Now when you get a transient or brief loss of consciousness because of decreased blood supply and hence oxygen and nutrition to the brain, and this happen because your blood pressure it dropped suddenly. And usually it take the person go pass out and then get right back up after about 1 to 2 minutes. And then it really stay. If it starts stay beyond 2 minutes, then another problem probably they happen. Now, we will talk about the most common cause of syncope, the most common types of syncope. Vasovagal syncope now the most common one. Another two types them now orthostatic hypotension syncope and cardiac or cardiovascular syncope. Those other two then we will talk about them for the next video, but we will focus on vasovagal syncope. First of all, more even see how what did it happen for regulate blood supply for body. As I stand so, because of gravity, tendency go be now say blood supply go be now only for the lower portion of the body. But the body works in a miraculous way and it gets some particular reflex mechanisms and way it help for maintain blood supply to the upper portion of the body. One of those reflex mechanisms then it cause our blood vessels for vasoconstrict, for tighten up. Another reflex, another mechanism now for cause your heart rate for be within a certain range for maintain blood pressure for your upper portion of your body. Now, why they call and say vasovagal syncope? Because some particular nerve they call and say vagus nerve. When you stimulate that nerve, it cause a drop in blood in heart rate, it cause a vasodilation, and as a result, a drop in blood pressure. And if that drop in blood pressure be excessive, then you feel lightheaded and you feel pass out. What will be some of the triggers them for this way if it make you for faint? Fatigue, if you be sleep deprived, if you be dehydrated, either because of medications like water pill, that blood pressure medication where they make and you urinate, they call and say diuretics, or if you be say you get diarrhea or vomiting, if you be stressed out, some of these things they feel predispose you for get this syncope. If you even stand for hot weather, especially for crowded area too, and if you stand for long time, if it predispose you. What will be some of the things and way if he cause you for pass out? So these things and now if you get those triggers and then these things are add on top, then it instead make you more predisposed for pass out. Some people them even by just coughing, some people then by eating and swallowing, some people then they way if they urinate or they defecate, especially if you distrain, you feel pass out. Some people then they way if they see blood, just the sight of blood, either when you draw blood from them or they see blood, if you make them, they pass out. Some people then they way sometimes they get some particular syndrome where they call and say carotid sinus syndrome. Some that carotid sinus they around this lateral aspect for neck, and it there for that area where along the blood vessel where it supply blood from your heart to your brain. And if you stimulate that area, either because you shave or you wear tie way tight, or you get a shirt and you button the collar be too tight, if you stimulate that area, press on that area, and it go send signal then for your brain, and that one will cause your heart rate for drop, and it cause vasodilation, your blood pressure to drop, and as a result, you feel pass out. Sometimes that day where you go see them for die place, some person because of strong emotions, people they cry or and they be stressed, and on top of that, sometimes they never even chop too. That kind of condition to strong emotions and pain, if it cause some people them for pass out. So some certain warning signs and they with this vasovagal syncope, before you want pass out, you go generally get some warning sign them. Some people they will get lightheaded. Sometimes some people they go hear noise, some kind of wash like harsh noise inside their ear. Sometimes the way you go get blurry vision. Your vision go there some way. Some people they will be nauseous. They feel like they want to throw up. Some people in their way they go feel like say they just tired. They feel themselves. So you get warning signs and generally. When you get that warning signs and they so what way if you do some particular exercise and they so some of the exercises in the way if you do for prevent you from completely passing out or for buy time for give you enough time for get to a safe environment before you, or a safe place before you pass out, so that you don't injure yourself, you put your hand like this, you cross your leg, and if you do, I'm even sitting down, but you cross your leg, and then the muscles of your leg, your thigh, your abdomen, your buttocks, you tighten all your muscles and tighten even your jaw, and like this, for help, for blood for return to your heart and back to your brain, and prevent you from passing out. Another exercise where if you do now say if you actually squat down, and then you bend your head, you put your head like this. Then also, if you get for lie down, also if you lie down also for down, and then somebody, if you lift up your leg, or you put your own leg up, and sometimes even if you put your leg against the wall. So this exercise is what I just mentioned. It will help for increase your blood pressure, so blood will return back to the heart and then to the brain, and it will help for prevent you from completely passing out. And when you pass out, if you dey for down, make some person not just can't lift you up, because if they just lift you up, that blood, because of gravity, blood supply will go back down for your body. You go be lightheaded again, and you feel pass out again. So it be very important make una learn how to do some of these exercises them. And the reason we're lying down, it help for prevent the passing out now, because when you lie down, blood they return back to your heart, and then you get blood supply to your brain, so you dey on an even level, so you don't get that effect of gravity. So when person, if he dey for down, just leave it for that ground position until he feel comfortable and he feel like say if he stand up again. Things and way if you do them for prevent you from fainting include hydration, especially if you know say dehydration, it make you for your blood pressure for low and for faint. You know, if you take water pill, that diuretics, your doctor fee change your medication so that you take a different medication for control your blood pressure. If you get for stand up for a very long time, if you wear compression stockings for help for keep blood to the upper portion of your body. If you get for do blood draw, and say the sight of blood, it make you pass out, if you actually lie down and they do the blood draw, and before that even hydrate yourself. If you drink enough water, it will help you for not get those symptoms and for make you pass out. If you be person where you be constipated, and so when you go defecate, you get problems, eat plenty vegetable and fruit, or even take stool softener, so that make you get that problem. For people the way their blood pressure tends to be low, you feel actually eat salt or eat salty food for help for keep your blood pressure up. Also try for rest and even exercise for improve on your overall well-being. As much as fainting feel sometimes be frightening, if you make some people then fear, this particular vasovagal syncope, so be too bad. If you understand them and know how to manage them, you go be okay. Unlike if the cardiac syncope we will talk about will be more serious, and you get for make sure say they get to the bottom of it, for make sure say not anything where they need for address them before it cause some bigger problem. And because this vasovagal syncope, they give you warning sign, it sometimes give you enough time for get to a safe environment and lower yourself for down and do some of those maneuvers them for actually prevent you from passing out. I hope say una get something out of this video. Una share am with una family and friends them. And until next time, knowledge is power. Thank you. Dr. Brown Hilda Santo.